So the problem is that climate change is happening, it really is happening, and that a lot of people don't realize the incredible downstream ramifications of that on their health. Sometimes immediate, things like heat stroke and flooding and all that, and then chronic diseases, things like heart disease and lung disease clearly are worse when people are exposed either to extreme heat events or with general trends of general climate changes and extreme events.
Emergency medicine is kind of like a canary in the coal mine. We see things a little bit earlier than others do, and what I'm seeing now is just how big these impacts are and how much they're affecting people in their everyday lives.
What happens with our wildfires and climate are deeply interconnected to the health of the individual, and that's their cardiac health, it's their physical health, it's their mental health, and it is their overall well-being.
Poor air quality and excessive heat and triple-digit temperatures and the burden of pollution. So you can see where all of that confluence really compromises the health, primarily the breathing of not just young children, but preconception all the way to our elderly.
Climate change is the ultimate public health threat and challenge. I came to George Mason to create the Center for Climate Change Communication as a way of helping better understand the realities of climate change and better understand what we really need to do to address climate change. And the fact that if we do those things, we'll actually be creating a better world for our children and grandchildren.
The consortium has been an excellent resource for many of us in healthcare because we see the changes and we see the need, and oftentimes we feel like we're alone. We know that most Americans care about this issue and want to be able to keep our families safe, our neighbors safe, our communities safe. And the consortium has been an excellent vehicle for people coming together around best practices for how we can advocate around the health voice and around the solutions that we know are out there, and to come together as part of a broader movement.
You know, if we look back 10 or 20 years ago, nothing about what we are experiencing is normal. So I think that's the challenge, is for us to not become numb or think that these new catastrophic events that we're experiencing are the new normal.
And it's that interconnectedness of planetary health and human health that I believe is exciting, it's energizing, and it's really important to do because the trends right now are going in the wrong direction.